To be certified as a family nurse practitioner, you have to be certified by either AANPCB or ANCC. Family nurse practitioner students and new grad family nurse practitioner have to make the decision of which organization you want to go with. So in this episode, I'm going to talk about pros and cons of being certified by AANPCB and ANCC, and I'll share why I chose AANPCB and how you make the best decision for yourself. Let's dive in. こんにちは。アメリカ・ハワイ州でファミリーナースプラクティショナーをしている三浦美希です。私はもともと日本生まれで日本育ち、日本で生看護師として働いてから25歳の時にハワイでナースプラクティショナーになるために渡米しました。もともと留学生として渡米して仕事を通して自力でアメリカ永住権を取得。今では10年間ナースプラクティショナーとして産婦人科領域で働いていて、2024年には州ごとに1人しか選ばれない臨床で優秀なナースプラクティショナーとしてアメリカナースプラクティショナー協会から賞を受賞。また、Hawaii Association of Professional Nurses からはリーダーシップ賞も受賞しました。これまで留学、アメリカでキャリアアップすることにとっても苦労しましたが、その甲斐があって今では経済的に安定して仕事もプライベートも充実した生活を送っています。私のようにアメリカで看護師、ナースプラクティショナーとしてキャリアアップをしたい方を支援するために JNP プロジェクトを立ち上げました。この事業では看護留学のコーチングをはじめ、看護師やナースプラクティショナーとしてのキャリアアップの秘訣を実体験のもとにシェアしています。キャリアだけじゃなくて満足した人生を送りたい人の夢を心から応援しています。ぜひチャンネル登録、そして当プロジェクトのウェブサイトも見てください。では今回のエピソードに行きましょう。In this episode, we're gonna talk about pros and cons of being certified as a family nurse practitioner by AANPCB and ANCC. There are two organizations that certify nurse practitioner to be a family nurse practitioner. One is AANPCB, which stands for American Academy of Nurse Practitioners Certification Body. A lot of people misunderstand that this organization is the same as AANP, American Association of Nurse Practitioners, but as I said, AANPCB stands for American Academy of Nurse Practitioner Certification Body. So this AANPCB is completely different organization than American Association of Nurse Practitioners. Nurse practitioner who are certified as family nurse practitioner by AANPCB use the title of FNP-C, and the other one is ANCC, which stands for American Nurses Credential Center. Nurse practitioners who are certified by this organization oftentimes use title of FNP-BC. Now, a lot of students and new grad ask me this question: which certification body should I go with? What are the pros and cons? So we're gonna go over the pros and cons of each options, and I'll share why I chose AANPCB instead of ANCC. Now, first of all, you might have heard this rumor, which I heard when I was a student, that you should get certified by ANCC because employers prefer nurse practitioners certified by ANCC rather than ANPCB. But I've talked to so many nurse practitioners and nobody was asked which certification body were you certified when they are going through job interviews. So I don't know where this rumor is coming from. I don't think that matters. As a matter of fact, a lot of employers don't even know that there are multiple organizations that certify family nurse practitioner certification. So if you're worried, I really want to make sure that I can get a job, so should I just choose ANCC? I would say I don't think that should determine which one you should go, but I'll talk about what you should consider when you're choosing which organization to go with. So when you are deciding which organization you want to go with, you have to think about recertification.It's not about when you get certified as a family nurse practitioner for the first time, but you really have to think about when you have to renew your certification. First, let's talk about similarities between these two organizations. Both organizations require family nurse practitioners to recertify their certification every 5 years. With both organizations, you have two options to renew your certification, whether you retake certification exam or meet requirements.And with both organizations, if you choose not to take certification exam again and rather fulfill requirements, you have to complete certain hours of continuing education. Now let's talk about the difference. AANPCB requires 100 hours of continuing education, which includes 25 hours of advanced pharmacology.First pro of going with AANPCB is that certification exam focus on clinical skills. What this means is that the questions are very straightforward, and what you learn for the exam is directly helpful for school and NP practice. Now, on the other hand, ANCC's certification exam includes questions about professional practice.So just be careful that there will be non-clinical questions for the ANCC. With the ANPCB, you can convert up to 120 hours of precepting advanced practice students to 25 non-pharmacology continuing education hours.So if you are planning to precept students once you graduate, and I hope that you're gonna mentor some students because it's really fun and I love precepting students, but this is a good thing to note. Another pro of going with AANPCB is that the renewal is cheaper than ANCC.As I mentioned, with both organizations, we have to renew certification every 5 years. And if you choose to renew by practice hours and continuing education, and you do it online, it will cost $195 as of June of 2025.And if you are ANP members, American Association of Nurse Practitioner members, you can get a discount, and it will cost $120 as of June 2025. Now, there are some cons of being certified by AANPCB. First con is that you have to either retake certification exam or have 1,000 clinical hours of practicing as a nurse practitioner within the last 5 years. They did expand the definition of clinical hours.So now you can use the hours that you spend on direct patient care, administrative work, education, and research. But regardless of different roles, you have to have a total of 1,000 hours.
今回のエピソードをお話しする前に素敵なお知らせがあります。英語を使って患者さんと接するすべての医療者のために作られた実践的な医療英会話のコース、医療英語101。患者さんから信頼されるための医療英会話のコースが開講されました。このコースはアメリカに留学、移住、そしてキャリアアップしたい方も含め、日本で医療を提供していて英語をしゃべる患者さんとよりいいコミュニケーションを取りたい方のためのクラスです。このコースではよりプロとして信頼されるための英語のフレーズだけじゃなくて、アメリカの文化をよく知ることでいろんな場面に対応できるプロとしての医療英語を教えています。アメリカに何年何十年と住んでいても、またパートナーがアメリカ人であっても、一見ペラペラと英語が喋るように見えても、ちゃんと医療英語の基礎を学ばないとプロとして信用される医療英会話はできません。私はアメリカで大学院を出て、そしてナースプラクティショナーとしてアメリカで10年勤務してきて、このプロとしての医療英会話の方法を身につけました。そしてアメリカのナースプラクティショナー協会から優秀な臨床実践を認められて賞も受賞するようになりました。 これはやっぱりただなんとなく手探りで英語を喋っていただけじゃなくて、医療英語の基礎をきちんと学んだからだと思います。よりいろんなキャリアアップのチャンスをつかみたい、患者さんからより信頼されたいという方はぜひこのコースを取ってください。まずは無料でレッスン1を体験できますので、下のリンクからぜひ申し込んでください。では今回のエピソードに行きましょう。
Now, con of going with ANCC is the cost. It will cost much more to go with ANCC when you renew compared to AANPCB. As I mentioned, it is cheaper to renew your certification with AANPCB. With ANCC, you have to pay $375. But here is the good news. If you are an American Nurses Association member, you can get a $100 discount, so it will be $275. And if you are AANP, American Association Nurse Practitioners member, the cost will be $295. Now, there are multiple pros of going with ANCC. As I mentioned, with AANPCB, you have to choose either you have a total of 1,000 clinical hours or retake exam. But with ANCC, you have more options. Other than direct patient care, you can also use hours for presentation, EBP or QI project, publication, research and presentation, preceptor hours, and volunteer work. And depending on different roles and tasks, you don't have to have 1,000 hours. You only need to fulfill much less hours depending on the role. For example, if you choose to use the presentation hour to recertify your family nurse practitioner certification by ANCC, requirement is performing one or more presentation totaling 5 o'clock hours in your specialty. Now, of course, preparing for presentation takes more than 5 hours. You can't just stand up there and then start talking and do presentation. It will take some time to prepare, but if you are very quick to prepare the presentation, it will definitely take less than 1,000 hours. Also, another pro is ANCC requires 25 hours less continuing education hours compared to AANPCB, which might be important for some people. Now, for me, I always spend time using up-to-date and keep learning most current guidelines, so I'll definitely fulfill more than 100 continuing hours very easily. It's not that important whether I need to fulfill 100 hours or 75 hours, but for some, the difference might be big. So we reviewed pros and cons of going with AANPCB and ANCC. Now let's talk about things to consider when you're making that decision. First thing you should think about is your plan for spending non-clinical roles. For example, in 2025, there are 52 weeks. So if you work 40 hours per week, you will get 2,080 hours during just 1 year, 2025. So if you plan to stay in clinical side, work 40 hours per week, it shouldn't be a problem to fulfill 1,000 hours of clinical hours per the next 5 years. Even if you get into accident, you are gonna be disabled and have to take few months off, or maybe you get pregnant, you take maternity leave, shouldn't be that hard to get 1,000 hours for the next 5 years if you plan to work in clinical side and 40 hours per week. But if you are considering going to non-clinical roles, for example, becoming a faculty or being a researcher, and you plan not to provide direct patient care 40 hours per week, then with ANCC, you may be able to just provide 1 or 2 presentations per next 5 years instead of juggling to get 1,000 clinical hours with AANPCB. So whether you plan to practice and provide direct patient care and work full-time, or if you plan to assume non-clinical roles, or plan to work less than full-time, then you really need to consider what will be best. Should I go with ANCC? That might be possible because you might not need 1,000 clinical hours like AANPCB requires. Another thing to consider is how many more years do you plan to practice as a family nurse practitioner? This is important because that equals to how many times you have to renew your family nurse practitioner certification. This was one of the reasons why I decided to go with AANP because, like I said, it's cheaper to renew with AANP. Plus, I was very sure that I want to stay in clinical side. And when I first certified as a family nurse practitioner, I was either 29 or 30. And I was pretty sure that I want to continue working at least 65, 70, or 75. I love what I do. And when I calculate, okay, how many times do I have to recertify as a family nurse practitioner? That little difference of certification fee makes a huge difference if I have to renew 8 times in my lifetime. So for example, if you plan to work as a family nurse practitioner for the next 40 years, you have to renew 8 times. And that means that you will pay $900 more with ANCC than if you choose AANPCB, if you are ANP member. But the difference of the renewal fee might not make a huge difference if you only plan to work for the next 10 years. Then you just renew one time and that's it. So it doesn't make huge difference. So this really depends on your situation. Do you plan to work as a family nurse practitioner for decades and decades? Or is it going to be the next only 5 years, 10 years? AKA, how many times do you have to renew your certification? Lastly, you have to consider, do you want to have less hour requirement for continuing education? Like I said, with ANCC, you only need 75 hours of continuing education, while with ANPCB, you have to have 100 hours of continuing education. And if that matters a lot, you may choose to go with ANCC. I hope this video was helpful for you. If you like this video, please give me a thumbs up and make sure to subscribe to our channel. We upload new episode every week. Also, if you have any comments or for future episode, please share in the comment section. Alright, I'll see you in the next episode. Aloha!